Hi, welcome back to Northern Medina County Chamber Alliance Buzz on Business. Today we have Dr. Richard Shewbridge with us from the Cleveland Clinic. Thank you so much for being here today, and I just want to tell you as a northeastern Ohio person how appreciative I am of having a facility such as a Cleveland Clinic in our backyard. So why don't you share a little bit about yourself and the clinic, if you would?
Sure. I'm a Cleveland Clinic doctor myself. I'm an endocrinologist. I've been in the Medina area since 1996 and joined the Cleveland Clinic in 2010. And I've been serving Medina Hospital as president for about 5.5 years now. And so we're continually working on making Medina Hospital the best place to receive care as part of the Cleveland Clinic and all the things that the Cleveland Clinic can bring to bear on the healthcare system. And we found that to be tremendously helpful to us as we continue the legacy of Medina Hospital, which was founded in the mid-40s.
Well, and my wife, when she was young, broke her leg, went to Medina Hospital, and the transformation that has happened from what we remember the hospital to what it is now. Why don't you share what are some of the areas that you're seeing a lot of people, some interest in, that you're getting a lot of focus, a lot of patients from?
Well, we pride ourselves at Medina Hospital on our orthopedic care, among other things. And we have state-of-the-art robotic surgery now for knee replacements. And we are adding new providers and surgeons to be the best place to get your orthopedic care in the entire area.
Now, when knee replacements, that's something I hear a lot. Knee, hip, ankle. Now, how long? I remember back in the day, the knee replacement, it was kind of a long journey. You had the physical therapy at home. Has, with the newer technology, newer approach, has that shortened that cycle?
Well, the robotic surgery with its increased precision as to where the cuts and screws and so forth are taking place can make for less pain and a quicker recovery after the surgery. So we're seeing that and being increasingly popular and something that patients are asking for, and we're certainly glad to deliver that service at Medina Hospital.
Oh no, that's great. As being the tail end of the baby boomer, I foresee myself being a patient here in the near future for I guess a little tune-up on my knees.
Well, we'd be happy to help you.
And I did note too that looking over, you have the 4 pillars of care. It's patients, caregivers, organization, and community. Right. If you would just briefly touch on those, because I really thought it's something we should know.
Well, our CEO, Dr. Tom Mihaljevic, took over several years ago and wanted a way for us to explain our work to others and each other. And he described that we want to take the best care of patients, take care of each other like family, take care of our organization as if it was our own home, and then to take care of the community. And he reminds us continuously that we can't just do one of those things. We have to do all 4 of those things. And that results in fantastic care for everyone.
So it's really taking that home care and just getting the state-of-the-art care in a home care environment.
By taking the proper care of all 4 of those things, we can be the best we can be for our community.
Well, and I've noticed over the years, obviously, the expansion of the footprint into Medina Hospital, into Brunswick.
Yes.
And just, I love the fact that I know I can go there, and if there's something that is very serious, I could be life flighted, is that correct, to downtown, or how does that work?
We have the ability to do urgent transport either by ground or by air, and that is also available as a resource here in Brunswick at the Brunswick Family Health Center. There's a heliport on top of the buildings for urgent transfer, and then if the weather's bad, we have urgent ground transport as well. So yeah, the ability to get world-class care, whether we can do it here or in Cleveland, is an important aspect of the value that we bring to our communities.
And just with the expansion that you've had in the footprint, have you been impacted at all with the shortage of employees? Is there something as a community we could put the word out to help?
Well, a couple things on that. We are fortunate enough to have a large percentage of our caregivers actually live and work in our community.
That's great. So
we haven't had to go out and hire traveling nurses and other personnel as much as many other hospitals in this situation. It's not to say we haven't had challenges and where it can be tight at times, but that has been something that we've worked very hard on to make sure it's the best place to work in healthcare in addition to receive care. And that brings up a great point, Rob, in that we are hiring at Medina Hospital, and Cleveland Clinic is hiring in a number of areas, from nursing to environmental services to food service. We have a tremendous amount of availability, so folks can get a hop on the Cleveland Clinic website, clevelandclinic.org/careers, and take a look at what we're offering there, and we will train folks if needed.
Okay, and for everybody at home, will you want to hit that website again?
clevelandclinic.org/careers.
And I guess for a personal note, I know that the nasty C word, COVID,
yes,
is still about. What do you foresee with our, I guess, battle against COVID in the near future? And again, not holding you to anything, but right. What are the trends you're seeing?
Well, what we're seeing are some newer variants that are out there that are fortunately less virulent. In other words, they won't make you necessarily as critically ill, sick, or cause death, but they are much more contagious, which means that the virus will continue to spread in our communities, particularly during the winter months when we're inside together with each other. So we're encouraging folks to get boosters, get vaccinated, stay up with the latest boosters so that we can eventually eradicate this thing. Unfortunately, we've been seeing a fairly low but steady amount of COVID in our hospital over the last several months. That really hasn't gone away, but we've also been seeing less trips to the ICU for our patients and deaths from it. So it's still a serious problem that I think we can't afford to ignore. So things that we can do to help prevent the spread are very, very important.
And to your point, it's getting those boosters. Yes. And with the booster, that's where, and I don't want to put words in your mouth, but that's where you see the lesser strain or the lesser impact on us, more like a flu, a cold.
The effectiveness of the COVID vaccines has been nothing short of incredible. 90% effectiveness in preventing either getting the disease or getting severe disease.
Yeah.
So it's been tremendous. It's actually, the batting average of that vaccine is actually much higher than the flu vaccine.
Wow.
So it's really been, I think we'll find, as history records, this to be one of the great medical miracles that we've been able to pull off, is to get something in front of this virus as quickly as we did. And
I agree. And someone that goes and gets their boosters, I echo your statement that that's the most important thing. We have to take care of ourselves.
Yep.
That's critical.
Right.
Now, my last question is, I know that you're still practicing.
Yeah.
Now, you're running the Medina Hospital.
Right.
Now, that's a job in and of itself, right. But yet you're also practicing. Why don't you share a little bit about that?
I think that's part of the secret sauce of the Cleveland Clinic, and that it's physician-run, and in most critical leadership positions of the Cleveland Clinic have a physician at the helm, closely guided by other folks who are highly trained in the business aspect, of course. But the fact that I can see patients 2 days a week, I think is certainly helpful to my personal satisfaction to get to see patients, to keep my day job, if you will. But then I also get to help and lead others at the hospital. It's really the best job I've ever had.
Oh, I think that's phenomenal that you still have that connectivity.
Yes.
And knowing that when you sit down in your chair, that you still have that current, what's going on to make those decisions moving forward.
Right.
a great model. Dr. Shewbridge, thank you so much for being here today. We
thanks, Rob.
appreciate it, and we'll be right back.
When I was 10, my mom got deported. We had a difficult time, and I feel that's why I didn't get to finish school. My husband is really supportive in a way that he pushed me to go back to school.
She wants to have a career so her kids can look up to her.
They both keep me motivated to go to school, and they see that if I do it, like they can do it too, you know? I feel that everything's possible.
Find free adult education classes near you at finishyourdiploma.org.